DREDF, Healthcare Stories. Jim LeBrecht is being interviewed at the Ed Roberts campus in Berkeley, California.
My name is Jim LeBrecht, and I've lived in the East Bay of Northern California for about 33 years or so. And I grew up outside of New York City, went to college in San Diego, and then came up here in the fall of 1978 to go work at the Berkeley Repertory Theater as their sound designer. And did that for about 10 years, and then I started moving into the film industry and have been very fortunate and worked my way up in the film industry in Northern California. And now I have my own company, and we have a few people working with me, and we're one of the more sought after sound companies for documentary film and other things. I was born with spina bifida, and so I have no feeling for about the hips down. So I have no feeling in my legs. I use a wheelchair to get around. I've been pretty active my whole life. I'm a little bit heavy right now, but very, very mobile and very, very active. But there's issues with spina bifida around some urological issues. So about when I was 15, I have a urinary tract diversion. I have a bag that I use to collect urine, and there's outside of that, there's always some issues that a lot of paraplegics have around other bathroom matters. But in general, am in fairly good health. As I get older, we all kind of start getting the wear and tear on our body that may be a little bit more specific to our disabilities. And I have a pretty profound curvature of the spine, and it's starting to impact my lung capacity. I think that the kind of the more profound issue I had recently was when I had some hernia surgery about 3 years ago. The 48 hours or so after my hernia surgery were a lot worse than they needed to be. And I wanted an air mattress for the bed, couldn't get it ordered until I was in the hospital checked in. And that took days. They didn't really understand my body, otherwise I wouldn't have had a leaking pee bag coming all over the side of me right out of surgery, nor would they have left me on a bedpan for 20 or 30 minutes without feeling in my fanny. So I had a much harder time dealing post-op because they didn't really understand how best to take care of me. Right, so what happens if I don't get this air mattress for 2 days? Right initially, you want to make sure that you're preventing bed sores as best you can, especially for somebody like myself who can't feel his butt. It's really important. I think that if they had a better understanding of me and my needs and what could go wrong, and we had talked about it, it would have been great. I wish I was smart enough to say, by the way, would you make sure that my bag isn't leaking all over me after surgery? I don't know. I didn't think I really had to bring it up in the conversation, but there it was. So why is that? Because I had a surgeon that knew about hernias but didn't know about urological stuff? Like the nurses have never seen a pee bag before? It was like, to me, it was just like people were just so kind of focused on one thing and didn't know how to deal with it. It was really surprising. If you look at trying to treat all of your patients with as much help as possible, and that a pre-surgery interview has a subset of questions for people who have an ongoing illness, and that they develop a certain set of protocols for each of these things. I think the needs of somebody with MS would be different than the needs of somebody with cerebral palsy. I think that the needs of somebody with muscular dystrophy would be different than someone like myself with spina bifida. But to know these things and to get a sense of what you can do to make it much easier. I'm not talking about luxury. I'm not talking about thick robes and caviar. I'm talking about how are you going to make it so that it's no harder for this person than anybody else. Because life doesn't have to be harder just because you have a disability. Things are planned out of ignorance that do make our lives much more difficult. But they don't have to be that way. And in fact, if you probably followed some of these protocols, you'd probably get me out of the hospital sooner. Wouldn't that save some money? Here's the key here, I think. So there's many ways to deal with certain situations. But your patient that has a chronic illness has been dealing with it 24/7, and they're rolling into your, walking into your room, and it's like, and if you knew how to trust their judgment versus your years of experience in medical school, and collaborate with them, I think you get much better results. If all of your knowledge about kind of the world and techniques of dealing with folks has been based in medical school and has been based basically on people who are bipeds, people who are walking around who don't really have any active disability going on, then you're missing out on some really important information. I think that looking at your patient with a disability as a resource, not a problem, would be a really great place to start. Ask them and learn from them, and then share that information. So I, honest to God, don't recall being weighed before this surgery I had. And I don't really recall any questions around my disability and anesthesia and anesthesia. So as it turns out, when I come out of the ether back in the ICU, my arms are in restraints, and there's a tube going down my throat. And I'm in restraints because they didn't want me pulling out the tube. And they put the tube down my throat because they almost didn't do the surgery because I was so hard to intubate. My throat's rather small. I'm a big guy, no neck, yada, yada. So so not only did they not really know that I was a hard person to intubate and to be aware of that and plan for that, I wake up like this and I can't communicate. And so when I'm like this, and it's like, so no, Jim, we can't release you, because, you got to keep the thing. And I'm like going like this. And finally, Sarah says, he wants to write. And so there I am, like fairly drugged out, and I'm writing why and how long. And so I could at least find out what they were explaining to me, but I'm kind of doped up. And it's like, oh my God, what, to be all of a sudden tied up like that and not even know to expect that could be a possibility. It was horrible. It was freaking horrible. You live with a disability long enough and you have enough stuff going on, and it's like, it's not like you give up or anything, but it's like you have enough bad experiences, and it's like, this is just another horrible time in the hospital. This is just, nobody gets it. Nobody gets me. Nobody understands. And, am I a crybaby because of complaining about something like this? I think that, again, if you start looking at somebody like myself and say, whoa, there's something going on here. What do we do to make sure that things are going to go really smoothly? Is there something extra or something more specific that we should do? Because Mr. LeBrecht uses a wheelchair to get around and has spina bifida. And look at that neck on him. Didn't really happen. It didn't really happen. The other, issues I had may be relatively run-of-the-mill, unfortunately, but I wound up having an infection. And my doctor didn't handle the infection aggressively. And I was back in the hospital. And eventually, I was in the hospital a total of 3 times, surgery and 2 occurrences of the infection. I wound up having a PICC line on my arm for about 3 months, feeding me vancomycin. And because he didn't know how to treat my infection, nor did he take my concern about how I was feeling in his office seriously. I was having a cocktail party, okay? And, oh, yes, you're the hospital administrator for the city hospital. That's great. Let me give you an earful here, but I'll give you a short earful, all right? So I've never come across a situation where I felt that people were really prepared to take the best care of me. I don't believe that they knew what to do with me because I had a disability. And I think that they were guessing what they might need to do based on how they've treated all of these other people who don't have a chronic disability or an active disability. I don't think anybody has a protocol for it. I don't think anybody knows. And it's my life and my care and the amount of pain I'm going to have and the length and time, the length of my recovery. You really should. And it isn't about the ADA or, having to follow the law or something like that. It's the right way to take care of people. Talk to me. I'm your best resource to know what to do with me. The camera loves me, you know that. It cannot help itself.
Healthcare stories. Made possible with generous support from the Manuel D. and Rhoda Mayerson Foundation. Jim LeBrecht was interviewed at the Ed Roberts campus, Berkeley, California, April 2011. For more information, visit the Disability Rights, Education, and Defense Fund website, dredf.org/healthcare-stories. This work is licensed under a Creative Commons Attribution Non-Commercial Share Alike 3.0 Unported license.